My name is Mark Sakwa. I am the Chief of Cardiovascular Surgery at Long Beach Medical Center. Well, let me start by saying that 5 years ago, I came to Long Beach Medical Center. And at that time, we did not have a forum where we could evaluate patients in a multidisciplinary arena, basically. Fortunately, when I was able to work with Dr. Chevelle, our Chief of Cardiology, together we decided that this would be a good forum where doctors could get together, review patients together, and not only discuss various options for the patients, but actually give the patients their best chance to get multiple opinions and come up with the best treatment option. And that's really what our clinic is all about. It's a multidisciplinary approach to complex valve disease.
David Chevelle, Director of Adult Cardiology at Long Beach Medical Center. For the valve clinic, we have a number of different doctors, including cardiothoracic surgeon, advanced care practitioners, interventional cardiologists, and imaging specialists. Imaging specialists that are specialists in looking at transesophageal echocardiograms and CT scans, for example. So at the valve clinic, we try to review all of the previous tests, imaging studies a patient has had, and try to come up with recommendations based on those imaging findings, patient's preference, and our medical recommendations.
Dr. Chevelle runs our valve clinic, and he has his cardiology team of both non-interventional and interventional cardiologists that perform procedures. We have our heart failure expert cardiologist, and we even have our electrophysiology cardiologists. We have all of our heart surgeons together along with our physician's assistants, and we include our administrators, our nurse practitioners, and also our ICU nurses can come to see how we evaluate the patients, which helps in the overall care of these patients.
Yeah, so we're lucky at Long Beach Medical Center. We have two advanced imaging specialists, Dr. Cristina Rodriguez and Dr. Fernando Mendoza, are both experts in CT scanning, PET scanning, and CT scanning. And so at the valve clinic, we typically have them independently review all of the studies and give us their own impressions of what the studies show.
So if our patients are younger, we often direct them towards surgical approaches. If our patients are elder, obviously we look for least invasive ways. If not surgery, then some type of catheter approach. We take into account the patient's comorbidities, and by that I mean other illnesses they have. So if there's multiple illnesses that may make a surgical recovery long or difficult, then again, we have a discussion as to are there catheter approaches to treat these patients. There are also patients who aren't candidates for some of the catheter approaches, which is these patients are then referred for surgery, and those patients can have a minimally invasive surgical approach.
So the patients we think do better with a minimally invasive non-surgical approach are those patients that have elderly age, patients perhaps with other medical issues, patients who perhaps are not going to recover as fast after surgery, maybe patients that are on certain medications that will limit their recovery after surgery. And for those patients, most of the time we can offer a non-surgical approach for their underlying condition.
If patients would like more information on the Long Beach Hospital Valve Clinic, they can either call us at area code 562-933-3370 or go to our website, memorialcare.org/lbheart.